Meanwhile, dozens of state lawmakers sent this letter to the governor asking her to, quote, take urgent action and declare a state disaster emergency surrounding the opioid epidemic. Local Senators Sean Ryan and Tim Kennedy are among those who signed on to this letter with support from fellow Democrats and Republicans, very bipartisan. The letter points out that there are already emergencies declared in these 8 states plus Washington, D.C. And here in New York, the crisis has been worsening to the point that every 90 minutes, someone in this state dies from a preventable death due to an overdose. This crisis is constantly changing, and it's really important that the public understand the stakes. So joining me live now is Kate Chudoba. She's Marketing Communications Manager with Western New York United Against Drug and Alcohol Abuse. I appreciate you coming on a Friday night, and we'll leave the politics of this up to the lawmakers and the governor and whether or not we need this emergency declaration. But really wanted to ask you, and I know you work with the Opiate Task Force, and you're constantly looking at the numbers to see how we need to adjust our response. Are you seeing any improvement over 2023? Because we know last year we had more overdose deaths in Erie County than ever before.
You're right, we did. Unfortunately, 2023 was our worst year ever with 418 confirmed overdose deaths. So this year we're hoping to bring that number back down. We are working diligently. We are trying to meet everybody where they're at in their journey. We continue to work on reducing those overdose deaths, whether it be to educate our community members, educate parents, and just really make sure everybody is aware that this landscape has drastically changed and everybody needs to be very vigilant about any medications or drugs or pills that they're using.
Yeah, we think so much when we talk about the opioid epidemic with the getting addicted to prescription painkillers, right? Fentanyl has changed the game, and originally fentanyl was laced into some things. Now it's really so much related to cocaine. Talk to me about that and what the public needs to know there.
Sure. So yeah, when this first started, and we'll start in 2016 when our task force was created, we were really seeing a lot of overdose deaths from opioids. Fentanyl has drastically changed the game, and because illicit fentanyl can be produced quickly and easily, that it is being laced into everything. Cocaine now in Erie County, we had over 46% of all deaths were in the age of 50 plus, and more than 75% of all the opioid-related deaths were cocaine mixed with fentanyl. So it's really changed it. Fentanyl, if you're seeing pills, you don't know if they're a true pill unless you're getting it from a doctor or your pharmacy. But if you're getting it from anybody else, you have to be aware that that could very likely be a fake fentanyl.
Kate, there are so many different groups working with the state, working with the county and localities to try to make sure that we have all the resources that we need to deal with this crisis. I can remember covering stories years ago about how we didn't have enough inpatient beds for people who were seeking that kind of treatment. Are the resources there, and this is really becoming more of a let's inform the public beforehand, or do we still have some areas that need improvement?
Well, there's always room for improvement, right? But we have come leaps and bounds. We do have a lot of beds available. We have hotlines set up. Erie County has really led the charge for the nation in how to deal with the opioid epidemic. So we are proud of everything we've accomplished here in Western New York. But like I said, we still have a lot of room for improvement. So we have a 24-hour addiction hotline. We have free Narcan that's now available. We have fentanyl test strips that are now available. Resources are out there. We need to continue to educate the community and make everybody aware that the landscape has changed and that help is available.
Those overdose death numbers are just staggering, and I know that you and so many people are working to improve those numbers. That's certainly the goal. Kate Chudoba is with the Western New York United Group, one of many helping our community. Thanks so much, Kate. We really appreciate your time.
Thanks, Michael.